Dumo, Ren, and the extra meridian channels. And with this, we'll be ending the basic anatomy of our channels, and we'll proceed on to the therapeutic uses from tomorrow onwards. And 29th, we'll have again the grand practical for all the participants who have joined this course. So today's lecture will be taken by Dr. Preeti Vashni. She is Associate Professor at Department of LHMC and Lady Hardiat and Associated Hospitals. And this is in conjunction with the IACP and MedTalks. So over to Dr. Preeti for her lecture now.
Thank you, Dr. Nishan. Okay, so I'll be talking about DU and REN channels and extraordinary or extra meridian points. Okay, so I'll be talking about the course of channels, the frequently used points, location, uses, and techniques of puncture. So DU and REN channels are two unpaired channels, but they are classified with the 12 paired channels to make up a total of 14 channels. They run in midline from down to up. DU channel runs in the back, while the REN channel runs in the front. There is a luo connecting point in both the channels, and the 2 points are connected to each other via the internal organs, where the change of polarity of energy may occur every 12 hours. Complete cycle of circulation takes 24 hours. So this is to show the flow of energy in REN and DU channels. So energy circulates in both the channels from below upwards, as you can see. From below upwards in DU, from below upwards in REN channel, enter the interior at the mouth and travel downwards along the GIT to balance the energies of the 6 sets of coupled internal organs. I hope the basics are clear till now. So let's talk about DU channel. It's also known as Dumo channel. It has a yang polarity. It is not linked to any internal organ. Till now, what all channels you have read are linked to one or the other internal organs like liver, kidneys, spleen, large intestine, small intestine. But this channel, DU and REN, are not linked to any internal organ. But DU channel has an influence on every other organ, and it has a very commanding, governing influence. So it's also known as governor vessel. There are a total of 28 points which run in back over the spinal cord and the brain in midline from anus to the mouth. Functions of this channel is closely linked to those of CNS. So you can see here the channel runs from below upwards in the center, over the back, head, and comes in front, over the face, and the last point is inside the mouth. Okay. So luo connecting point is DU1 or Changguang. It's midway between the tip of the coccyx and the anus. So that means posterior to the anus. And it is easily located in prone or lateral position. We only use this point in anorectal disorders. Okay. So DU channel per se is useful for anorectal disorders, low backache, immune and infective disorders. Very, very important. All immune and infective disorders, if you are dealing with, you have to have some points of DU channel, which I will be talking about. Mental and neurological disorders, because it is related to CNS, it runs over back and spine and head. And oral disorders, since it enters inside the mouth. So the common point which we use is one is Dumo 3 or Yao Yang Quan. It is located on the back in the midline between the dorsal spines of L4 and L5 at the level of upper border of iliac crest. Are we aware of this point L4, L5? Spinal, which is the line which runs through this? Tuffiers line. So between L4, L5 in the middle, we have tumor 3. And it is useful for low backache, genitourinary disorders or impotence. We have to perpendicularly puncture one shun, and the needle may be pointed slightly upwards towards the direction of the flow of energy. Then Dumo 4 or Mingmen, it is again located back at the back in the midline, but between the dorsal spines of L2 and 3. Indications are again low backache, genitourinary disorder, same. And the puncture technique is also same. One shun perpendicularly, needle is pointed slightly upwards. Dumo 14 or Tetri, it's a very important point. It's an immunity boosting point. And also in high fever, strong stimulation of this point brings down the fever. It is located at the back in the midline between the dorsal spines of C7 and T1. It is very important point. Try to remember Tumor 14 between the spines of C7 and T1. We'll be practicing this point also after the class. Okay. So indications, as you can try to imagine, since it is located between C7 and T1, so it is useful for cervical disorders, neck disorders, torticollis or spasm, shoulder pain, which is referred to the neck. Okay. It is also for thoracic spine, for ankylosing spondylitis. Then again, since it is close to head, mental disorders, epilepsy, convulsions, lung disorders like bronchitis, asthma, cough, and since it is immunity boosting point, so skin disorders, eczema, infective or immune disorders like cold or influenza. So the important point is one, strong stimulation of this point will bring down the fever. Number two, it's an immunity boosting point. Okay. And number three, also useful for bronchial asthma. Perpendicularly, one shun we have to puncture and slightly upward, slanting. So this is the location between the dorsal spines of C7 and T1. Next is Dumo 15. We don't practice this regularly, but it's an important point. So I'm telling you, it's one of the dangerous point. The location is between the dorsal spines of C1 and 2. That's why it is dangerous. कौन सा structure होता है उधर? Medulla. So you can damage the medulla if you are not careful with the puncture. So how do we locate the point? It is 0.5 shun above the posterior hairline or 3.5 shun above the C7 spinous process. Okay. So indications, deaf mutism, aphasia, aphonia, speech difficulties. How do we puncture? With the head semi-flexed, one shun perpendicularly in the direction towards the chin, as shown in the picture. Okay. This is another very important point, Dumo 20 or Baihui. It is a meeting point of 100 points, so acts as a governor. It is a very powerful sedative and tranquilizing point. It is useful to relieve psychogenic factors associated with all chronic disorders. So for acupuncture, whenever the patient comes, it will be mostly it will be a chronic disease. For acute disease, patient will not come for acupuncture therapy. And all chronic disorders will have some psychological component because patient is, very much bothered for so long, he's suffering. So this point is very good to calm down, for tranquilizing, and it is very good point to commence the first therapy because it is painless and patient cannot see the needle because the point is at the head. Okay. So indications, again, best tranquilizing and sedative point for all psychiatric and neurological disorders, then headache, cerebrovascular disorders, loss of memory, and also alopecia. How do we locate this point? It is on the vertex. There are various ways of locating. How do we minimize this bar? ऊपर ही जो बार आ रही है, how do we minimize this? हाँ, किसमें? उसमें दिख रहा है पूरा। और मेरी पिक्चर आ रही है? आ रही है? अच्छा, इसमें नहीं आ रहा। ओके। Okay, so location is on the vertex. There are various ways as shown in the picture. 3 shown above the 8 shown up from the glabella, then from the anterior hairline, from the posterior hairline, from the cervical spine. But the easiest method which I find is that you join a line from earlobe to the apex of the auricle, extend it towards the midline. So you will get the vertex of the scalp. That is Tumo 20. Okay. So we have to puncture 0.3 to 0.5 should obliquely or horizontally directed posteriorly. It's not a perpendicular puncture, it's oblique puncture directed posteriorly. Another point is Tumo 26 or Jensen. It's the point for emergency treatment of fainting. It is located again in the midline at the junction of upper 1/3 and lower 2/3 of the philtrum of upper lip, as shown in the picture. Indications, it's for acute emergencies like fainting, convulsion, shock, heat stroke, hysterical attack. What is Jingwell point? What do we mean by Jingwell point? Jingwell points are the points which are specially meant to stimulate the energy in the channel, where the energy where the energy is blocked. So we specifically stimulate those points and the energy flow in the whole channel is restored. Okay, so this is the Jingwell point for acute emergencies, fainting, convulsion, shock, heat stroke, etc. Acute low backache, it's a distal point for that. And again, it's on the face, so facial paralysis or painful disorders and swellings of the face. Puncture 0.3 to 0.5 should obliquely, backwards and upwards. Or in acute emergency, nail of the finger can be used to stimulate this point, like patient is fainting or has convulsions or shock. Okay, so about Dumo channel, which is the immunity boosting point. कौन सा बताया मैंने अभी what all I have taught about Dumo channel, the questions are from that. DU 14, Dumo 14, where is it? C7 and T1 के बीच में. Okay. Which is the tranquilizing point? Dumo 20. Okay, on the vertex of the scalp. What is the other name of DU channel? Governor vessel. Where does the Dumo channel end? Last point. Inside the mouth. Okay. So coming to Rain channel, it is also called as conception vessel because it has influence on the reproductive functions. It's another unpaired midline channel which runs in the front of the body. It has yin polarity and it has controlling influence over all the yin channels and on the interiorly situated alarm points of certain internal organs. What are alarm points? Suppose there is some stomach problem. So alarm point of the stomach, at that point, there will definitely be tenderness if you press that point. There are few specific points which designate the specific organ. So REM channel has most of the alarm points. That means alarm points for most of the internal organs. Okay. We don't teach that, but for your depth of knowledge, if you are aware, then you know, okay, this problem is there, alarm point to stimulate karoge, so it will be helpful. So there are various alarm points which are situated anteriorly on this channel. There are a total of 24 points And Leo connecting point, as I told you, REN 15 is the Leo connecting point, just for the knowledge. So REN channel is used for genitourinary and disorders along the pathway of the channel, such that GI, heart, lung, aphasia, aphonia, dysarthria, facial paralysis, excessive salivation. So you can see this is the REN channel. So it starts just in front of the anus. Dumo channel, the first point was posteriorly to the anus, okay, between the tip of coccyx and the anus. Here it is in front of anus and it runs in the midline over the front of the body, okay. And the last point is again just below the mouth, below the lower lip. So important point, REN 12 or Changwan, it is a alarm point of the stomach. And it is located in the front midline, midway between the xiphoid process and umbilicus, or just 4 shun directly above the umbilicus, as shown in the picture. We have to puncture 1.5 shun perpendicularly, and indications are peptic ulcer, abdominal distension, flatulence, dyspepsia, nausea, and vomiting, all stomach-related disorders. Then REN 17 or it's an inflammatory system, and it is located on the sternum midway between the two nipples at the level of fourth intercostal space. So indications are heart disease, bronchial asthma, and other lung disorders, and also breast disorders. So how do you puncture? You puncture 1 shun horizontally downwards. But if you are doing this point for breast disease, then you will point the needle towards the affected breast. Then again, REN 22 or TN2. It's another point very important for bronchial asthma, but it is one of the dangerous point. What was the dangerous point in Dumo? DU channel? कौन सा point? DU 15. So here it is REN 22 or TN2, which is the dangerous point. It is the best point for treating acute attacks of asthma or hiccup. It is located just 0.5 shun above the sternal notch in the center, and indications are bronchial asthma, hiccups, dysphagia. How do you do the proper needling? So the steps are, we have to locate the point in comfortably seated position. Neutral position में just 0.5 shun above the sternal notch, you will locate the point. Insert the needle perpendicularly first, little bit, 0.3 shun, and then extend the patient's neck. And you direct the needle downwards and posteriorly along the posterior border of sternum. So you have to ensure that the patient is comfortable and can swallow without pain. There is no injury to trachea or mediastinum. Sorry? देखो, it is 1 to 1.5 shun downwards. 1 to 1.5 shun का मतलब समझते हो, इतना down. Okay, so this is just to show you कि अगर तुम यहाँ से जाओगे, if you are going deeper, you can't injure any portion, or if your direction is not correct, then also you may injure any deeper structure. Okay. So, which is the dangerous point in REN channel? TN2, it is REN 22. REN 22 or TN2. What is it used for? Acute attack of asthma or hiccups, right? What is the other name of REN channel? Conception vessel. It has an effect of on the reproductive organs. And what else is important about REN channel? We discussed alarm point for. So I told you 2 alarm points: stomach and pericardium. Right? REN 17 is pericardium, intermammary line, and the other one was REN 12 for the stomach. So now we deal with extraordinary points, or also known as extra meridian points. These are the new points which are discovered after the points were placed in their appropriate channels. Uske baad people discovered that there are few more points which cannot be placed over any channels, but they are important. So there are 36 extra meridian points, and each extra meridian point can be a group of points. Okay, so this point will be clear as I tell you important points. So the first is yin tang. It is also known as Dumo 24.5 because it's located very close to Du 24. It is located just at the glabella on the ridge of nose midway between medial ends of two eyebrows, where the medial ends of two eyebrows meet on the ridge of the nose. Glabella is Du 24. Okay, so just below that is yin tang or extrameridian 1. Indications: sinusitis, rhinitis, headache, eye disorders, or endocrine disorders, especially pituitary. It's very important point for pituitary disorders. You have to puncture 0.5 shun horizontally downwards. Next is Taiyang or extrameridian 2. So there are two ways of locating it. You just extend the curved lines of the eyebrow and the lower eyelid outwards, and where they cross, you get the point, extrameridian 2. Okay. So it is useful for headache, migraine, eye disorders, facial paralysis, toothache, sinusitis. So all facial disorders. But you have to direct the needle accordingly. Okay. So you have to puncture 0.5 shun perpendicularly for headache or migraine, towards the eye for eye disorders, downwards for toothache or maxillary sinusitis. So extrameridian 6 or Shuden Sung. Okay, so you remember where I told you 2 more 20? Bywing. Yeah. So just one shun, anterior, posterior, and laterally, we get the 4 points which are called extrameridian 6. So I told you that one point can be a cluster of several points. So this extrameridian 6 is actually 4 points. Are you all understanding? So these are also known as 4 intelligences because in Chinese this is known as this means 4 Shuzhen Sang is known as intelligence. So it is frequently used together with Dumo 20. Indications again: headache, epilepsy, apoplexy, and alopecia. So we have to puncture 0.5 shun horizontally towards the Dumo 20. All 4 locations will point towards the Dumo 20. And where do we point the needle in Dumo 20? Which direction? Posteriorly. Next is extrameridian 7 or Yiming. Okay, so it lies in the groove between ear and mastoid on a straight line connecting Sanjiao 17 and gallbladder 20. All of you remember Sanjiao 17 and gallbladder 20? See in picture and can you remember? Sanjiao 17 is just behind the ear lobule in the groove between the mastoid and ear lobule. This is a small groove. So Sanjiao 17 and GB20, if you join, then midway between that is Yiming. It is again useful for ear and eye disorders, and we have to puncture 0.5 shun perpendicularly. Next is Ding Chuan or extrameridian 17. So it is again soothing asthma. I told you, remember Dumo 14? You all remember Dumo 14? Immunity boosting point between C7 and D1. It's also useful for, I told you, bronchial asthma. Besides neck, spine, shoulder, and immunity boosting points, it's also useful for bronchial asthma. So similarly, just 0.5 from lateral to Dumo 14 are these 2 points which are also very useful for bronchial asthma. The needle is directed towards Dumo 14, slightly medially, 0.5 should directed slightly medially. Now, so extrameridian 21 or Hua Tuo Chiachi, they are the series of 28 pairs of points. How do we locate them? Point 5 should lateral to the lower ends of dorsal spines of C1 to S4. So you have to locate the sinus process, lower end of sinus process, and point 5 should lateral. Sinus process, lower end of sinus process, and point 5 should lateral to that on each side, right and left. So there are the paired points. And how many sinus process we have? 26 if you don't count S3 and 4. If you count till S4, then there are 28. So we have 28 pairs of points in this single point extrameridian 21. These are very, very useful points for backaches. And as I told you the previous point, Ding Chuan, it is one of the extrameridian 21 part of that. Okay, because it is 0.5 should lateral to the spinous process of C7 and T1 के बीच में. Okay, so everybody has understood? Extrameridian 21, series of 28 pairs of points. 0.5 should lateral to the lower ends of dorsal spines of C1 to S4. Indications: pain along the spine or segmental nerve, disorders of the internal organ at the corresponding level. So you puncture perpendicularly or slightly medially, direct slightly medially. For cervical and thoracic regions, because there's not so much muscle mass, it is just you have to go to a depth of 0.5 to 1 shun. While for lumbar and sacral region, 1 to 1.5 shun. Pashi or extrameridian 28. These are the set of 8 points best located with the fist closed. And where are these located? On the webs. Okay, so with the fist closed, there are 1, 2, 3, and 4 webs. For the 5 fingers, we have 4 webs, as seen in the picture. So for 2 hands, we get total of 8 points. Okay, and they are useful for disorders of the fingers, rheumatoid arthritis, polyneuropathy, and numbness of the fingers. We have to puncture 1 shun obliquely and proximally. Extrameridian 30 or 61, there are 10 points just anterior to the nail, and these are located on all the tips of fingers. So there are 10 points. And indications are emergencies, basically for shock, heat strokes, and fever. And we puncture with the filiform needle to make them bleed. Just for the knowledge, okay? Hitting is on the midpoint of the upper border of patella. And it is a very useful point for disorders of the knee joint. Very simple point, just above the midpoint of the upper border of patella. Okay, it's known as hitting. 0.5 shun perpendicularly. Next is Lamby alarm point of the vermiform appendix. I have not taught all the alarm points, but this point is important because, you know, in acute appendicitis, if this point is tender, then that adds to your diagnosis. Okay, this patient might be having appendicitis. Or in a post-op patient of appendicectomy, then also this point can be tender. So if you give acupuncture at this point, it relieves the pain. So where is it located? It is 2 shun below stomach 36. Where is stomach 36? Lateral. So just below the tibial tuberosity, 0.5 shun lateral, stomach 36. 2 shun below that is this extrameridian 33. And we have to puncture 1 shun perpendicularly. Useful in appendicitis and post-operative pain after appendicectomy. Last is puffing or extrameridian 36. They are total of, again, 8 points as was in the hands. Hands are pashi. These are puffing. Okay. 8 points in the web spaces. Again, here also just 0.5 shun proximal to the webs between the 5 toes. So again, 4 points on each foot. Useful for arthritis of the toes, polyneuropathy, numbness of the foot and toes. You have to puncture 1 shun obliquely and proximally, same as with Pashi. So 3 of these points coincide with liver 2, stomach 44 and GB 43. कौन बताएगा कहाँ कहाँ होते हैं? Liver 2 कहाँ होता है? पैर में ही है ना, coincide कर रहे हैं. जो 4 points बने हुए हैं उसी में से होगा कोई ना कोई. Liver 42 कौन सा होता है? Stomach 44 और GB 43. So between first and second is liver 2. ठीक है. Between second and third, this is liver 2. Between first and second. Between second and third toe, this is stomach 44. Between the fourth and fifth toe, this is GB 43. Okay. Liver 2, stomach 44. Then leave 1 point and then GB 43. Okay. So what are the 4 intelligence extra-median points on head? And they are around which point? What is the name of that points? Extra-median 6. Okay. Where are your GRG points located? Extra-median 21. There are 28 pairs of points. Point 5 shown lateral to the spinous, lower end of spinous process of C1 to S4. Okay. And what are they used for? And spine problems. Which is the soothing asthma point? What is the name? Where is it located? Both sides. Tinchua. Extra median 7. Okay. How many points are there in Pafeng? 8. Pashi and Bafeng. Okay. Hand and foot. So we practice.
Thank you, Dr. Preeti, for an excellent lecture. I know these extra meridian points may be a bit difficult, but then, like other things, they have to be ratified to a certain extent. And now I think Dr. Preeti will demonstrate the important extra meridian, Duomo, and Ren points, how to needle them, and specifically for Duomo and Ren, because they might be alarm points. That means that there might be vital structures beneath these points, so you have to be careful when you negotiate your needle. डॉक्टर प्रीति किसका कैमरा यूज करेंगे सो दैट एक बार बता दीजिएगा सो दैट एवरीवन कैन फोकस ऑन देयर कैमरा ऑन दैट पर्टिकुलर कैमरा फॉर द डेमोंस्ट्रेशन.
Yes. Who has joined online? किसने किया हुआ है? तो कौन फोकस करेगा अपना कैमरा? किसका अच्छा कैमरा है? I will demonstrate points.
कैमरा कहाँ से देता है? ये रहा.
Dr. Divya will focus when I demonstrate.
मैम इसमें मैम स्पिरिचुअल क्वालिटी इनर वर्ड प्यूरी इनर वर्ड
I will demonstrate Dumo 40 to Dumo 20. सारे डेमोन्स्ट्रेशन फर्स्ट ईयर पे to start with should be, if possible, because it's a one calming effect. Second, it is painless and accessible. Patient cannot see the victim. You know, karo? हाँ, Jumo 20. So Jumo 20, then you cannot listen. So there are various ways to locate the point from the glabella, from the anterior hairline, from the T7 spine, from the posterior hairline. But as I've told you, from earlobe to the apex of the auricle, go straight towards the midline. Okay, so this is the vertex.
Please focus closely, go behind and then focus so that others can see. Or we can't see the neither the point, yeah, either from the side or from the back. Yes. Right.
from the side also you show.
So we keep the needle obliquely. That's it. 0.3 to 0.5 shin obliquely towards directed posterior. Okay. Sajid, how are you feeling? Was it painful? So it is usually not painful because the skin is thick and it's a very small needle and we just factor 0.3 to 0.5. Heavy, right? No? So it's a tranquilizing effect, sleepy effect. Where kahan heaviness feel ho rahi hai? Pura sir mein. Okay. Are you feeling sleepy? Relaxed? This heaviness, heavy feeling is troublesome or is it comfortable? So people around them. Soothing sahi hai. बोलना पड़ेगा कंसल्टेशन चलो ओके कहाँ हम स्टार्ट कर रहे हैं नीडल जो भी यूज करेगा कायदे से डिस्कार्ड करेगा नहीं तो किसी को चुप जाएगी अगले दिन आके इधर बाहर वाली डस्टबिन में ही डालो प्लीज उनको छोड़ देना वो दीपक अगले दिन सो डूमो 14 किसने विदाउट कॉलर वाला तो पहना
चलो फटाफट आओ. Anybody Neha? You come. I'll follow. Okay.
Atopic dermatitis with pneumococci will not flare up. It will have a soothing. It is an immunity boosting point, and I told you one of the indications. Okay.
You
Don't
are the
worry.
right choice, huh?
Don't worry, nothing will happen. Take out your step. Hairs थोड़ा सा कर लो. ठीक है.
उसका नीचे झुकना
Basi, don't
पड़ेगा.
worry. If you are not interested, then leave it. कोई और आ जाओ भाई.
कर लेगा.
नहीं, it's okay. Leave it.
Some other point.
चलो अच्छा कोई और नहीं. चलिए. कौन आ रहा है? आ जाओ ना voluntarily.
कोई भी आ जाए, उसका क्या घबराना है? CU20 लगवा लिया, बाकी तो उसके नीचे है.
क्या पॉइंट होता है डूमो 14? C7 and T1. So her C7 is very prominent. We can feel. Okay. And then next is T1. So between these 2 points, and where is the needle directed? 0.5 we go, 1 shun or 0.5 shun perpendicularly, slightly upwards. Okay. And again, just 0.5 shun, 0.5 shun lateral on both sides is the which point?
X7.
Extra meridian 7,
Seven.
which is Dingchuan. It is also soothing asthma point for bronchial asthma. Okay. So I'll be demonstrating Dumo. Okay. So Ankita, comfortable? Any problem with you? Like, it's not every time you may not feel.
You may not,
Okay.
but you have to be anatomically right.
So this is Dumo 14. It is the immunity boosting point, right? Very useful for
Video is not visible somehow. Can someone show the video?
it's on तेरा phone में देख रहा हूँ.
क्या तो रहा है?
It's on, it's visible. हाँ लैपटॉप में भी आ रहा है. तुम लोग को दिख रहा है तुम्हारे आ रहे हैं. Okay, so should I move? It's not necessarily that you have to put your head down so much. Okay, it can be in a neutral position. Otherwise, for 15 minutes, there will be more pain rather than relieving of cervical. So just 0.5 shun lateral on both sides is the extra meridian 7 for asthma, acute attack of asthma. Okay. Another point last is Yintan or the extra meridian 1 at the glabella. I'm not demonstrating.
They have demonstrated, they have seen it, so they'll do
Okay.
it.
This is very easy and you have told, I have told you 0.3 to 0.5.
ये तुम लोग कर लेंगे, ये वाला करोगे
Directed.
ठीक है एक दूसरे पे. सारे लोग
Horizontally
लगाओगे ये
down.
वाला point, है ना?
यही बताया था ना मैंने 0.3 to 0.5 shun
ये
directed
उसी कोई
downwards.
कोई ने लगा के दिखाया था ये. Do it.
220 to Dr. Kohli demonstrated Dr. Nishant only last जो
अच्छा.
acupuncture course किया था उन्होंने. हाँ. चलो practice.
चलो
Dr. Nishant.
एक्स्ट्रा मेडिटेशन में करो इंटर्न करो. ठीक है ना?
Reverse camera.
इजी है.
So they can practice with each other now.
तो कई दिन हो गए सेकंड वीक चल रहा है इतना डरो प्राइवेट का कोर्स करने का.
Thank you, Dr. Preeti. I think if we are practicing, we can end the session now.
Thank you.
Dr. Preeti, can we end the session now?
Yes, yes.
Okay. Thank you so much, Dr. Preeti. Farad, can we end the session?
Yes, sir. Sure, sir. I'm closing. Thank you so much, sir.
Yeah. Thank you. Thank you so much.